All right. Good morning, everyone. Welcome to Healthcare Worker and Integrative Professionals monthly group. My name is Nicole Durant, and I am a co-host of this monthly group. Dr. Tetlow has been running this lovely group for many, many years. A little more about Dr. Tetlow. She founded Philadelphia Integrative Medicine about 12 years ago, or as we like to call it, PIM, where we offer patient care as well as teach and train to offer integrative medicine care. PIM's vision is to empower, inspire change, create trust with patients, PIM providers and staff, the functional medical community, and ultimately the medical community at large. Dr. Tetlow maintains a patient care practice as well as a mentoring practice for clinicians in transition to or maintaining phases of integrative and functional medicine. If you are a healthcare provider or any type of provider, please visit our providers tab on our website. And without further ado, here is Dr. Tetlow to begin our monthly meeting.
Thank you so much, Nicole. And normally we like to capture and record a brief meditation to share with all the people who are registered and signed up for the monthly group who don't necessarily attend live. Monday morning at 8 o'clock Eastern time can be a challenging time, so we want to include you. And I'd like to do a brief sharing and then move into a meditation. And the brief sharing is that a number of colleagues and I have been discussing how our medical system is not actually set up for service to patients, and it's not necessarily set up for service to providers. It's a system that self-propels itself. And it really is, it's a marketplace, and it's kind of a machine that labels and diagnoses and treats and evaluates procedures over education. And it's a system that is not actually health-based, as many of us are aware. And so what that means for each of us is that we're in a process of healing and returning to a type of work that feels right for us. So if you're working in the healthcare system, finding a way to practice that is health-based, and that also includes your health. I wanted to acknowledge that what we're doing today is we're doing a foundational piece for being healthy as a healthcare worker, as an integrative professional. And that is to connect and be aware of oneself, how we are doing, a sense of embodiment, connection, a healthy connection with our body. What is emotional health? What is it like to be emotionally healthy? And then also connected. We are not all on our own individually trying to fix this. We are in a collective healing process. So it's individual, but it's also a collective process where we're sometimes working in a system that's not actually designed for us or our patients. And we're finding ways to practice. We're finding ways to set up our clinic, finding ways to transition to integrative medicine, or ways to practice as an integrative professional, promoting our own work and our own business, so that we can be part of this change. And what we're doing today is we're sourcing emotional support, and we're increasing our own sense of self-awareness and also our sense of community, which can really inform our emotional health. So our theme today, which you'll hear a little bit about in our meditation, is I allow myself to create my highest dream. So there's a foundation we'll do together, which is connecting, sensing, coming into our body and learning how to evolve and develop our own emotional health and the structures in our business and in our life that support us so that we feel well, that we feel healthy. But we're also doing something larger, which is listening for that heart song and following those whispers and messages from within to see what is my highest dream for myself and for my life. So we'll be talking about that together, because often the limiting factor in terms of what holds us back from that highest dream is sometimes us. And that's also where the liberating factor as well as the potentially limiting factor. So I'd like to move into a guided meditation. There'll just be a few slides that I share after the meditation, so just stay on. And then afterwards, we'll end the recording and we'll be meeting as a confidential group as we do each month to share and source peer support. So it's my pleasure, it's my greatest joy, my favorite thing to do every month is to be part of this group. And I'm going to place a hand on my heart and find my feet on the floor. Just looking around the space where I find myself. And when ready, just lowering gaze. And if you're comfortable, gently closing your eyes and being aware of your breathing. So we're breathing all the time, or sometimes holding our breath, but we have the potential to be breathing and allowing our breath. Bringing our awareness to our breathing. It's a beautiful way to connect and sense, how am I doing? Where am I today? And as you feel your seat and where you're sitting, or also feeling the sensations of your feet, whether that's in your shoes or in your shoes on the floor, feeling your feet, feeling your body, your breath coming in and out of you. Noticing and inviting yourself to come into this moment where you can feel yourself and feel your breath. Inviting and welcoming yourself as much as possible, creating safety to be just where you are in this moment. You are safe to be where you are in your skin. You're safe to have a few moments just to breathe, to exhale. Just giving yourself a few moments to arrive. Being gentle. Forgiving ourselves each time we might go into the past or future. And just gently inviting yourself back to a presence and the hand on your own heart. Letting yourself breathe. Letting yourself be. And as we sit here, we'll be inviting in a theme for the rest of our group this morning. And you can invite this question. And if you listen to the recording later, and I'm going to ask a question of each of us. And if you'd like to in the future, if you're listening, you can also pause the recording if you'd like some time just to reflect on this question. Emptying your mind and being in your body and your breath, I'll just drop a question in, and without just going into the mind and immediately to our thoughts, just being spacious and breathing and seeing what arises when I ask. What is your highest dream? What is your dream? And we'll continue to explore this together a little bit later, but we'll also be just gently exploring in the sense that we don't need to know an answer to this question. And our intention is, I allow myself to create my highest dream. And that means having some space to ask a question and to listen for an answer, having space to not have an answer, having things come to you at different times. And there really is an unfolding and a timing that sometimes we don't ask and hear and ask and hear. But to be curious and to be open and to be listening to yourself and to your heart throughout the day today and tomorrow and this week and this month. I allow myself to create my highest dream. What would my heart most desire? And it's easiest to allow some of those answers to bubble up when we feel that we deserve it and that we're allowed to ask and we have space to answer that question. And that's a process of giving ourselves space and of listening. So beginning to deepen breath, you might notice your chest rise and fall underneath your hand if you have your hand on your heart. Notice if your feet are still on the floor, if you're still in your body. And we go away and come back. We're just working on creating a maintenance state of gently, as consistently, and sometimes it's just 25% of the time, just being in our body, being aware that we're here, that we're breathing. We're not just our thoughts and our to-do list and our task list, that we have a presence and we can feel it. And we can be loving towards ourselves and welcoming. And we can be listening to ourselves. So let's complete this meditation and we'll just continue the recording for just a few more moments just to share. So wiggling toes and fingers, deepening your breath, a little bit of a deeper inhale and exhale. And I encourage you to stretch in any way that feels comfortable. When we do our meditation in the clinic, each clinic day, I often notice that I just yawn after doing this stretch. And I just want to share a few images and then we'll complete. In the words of Galway Kinnell, sometimes it's necessary to reteach a thing its loveliness. Sometimes it's necessary to reteach a thing its loveliness. And this is a quote that I shared, I think it was 2010 when I was leading a mindfulness-based stress reduction workshop for my patients. And we had some handouts for patients and I was teaching the MBSR course before I realized that I could ask for someone to help me to lead that class. So I didn't have to do patient care all day and teach mindfulness at night and burn out. And that is a quote that I used in that MBSR class that I took. I was trained as an MBSR teacher when I was in residency at Jefferson. Graduated from my residency in 2008 and taught that class 4 times a year until I realized I didn't need to push myself so hard. So next slide, Nicole. This is an image. So those of us who are listening, I'll describe it to you. This is an image that I've shared before, but it has a new meaning today. What we're looking at is I'm in the back seat of a very small plane, visualizing the cockpit and my brother in the pilot seat and an instructor just to his side. And he's looking at a landing strip and he's going to land this very small plane for the first time. And this image really touched me at the beginning of the pandemic because it was like taking off and landing and doing everything for the first time. And the sharing that I put with this image is it's through vulnerability and truth that we will get through this with the most ease. And as the pandemic continues to evolve and change, and as we continue to evolve and change, sometimes we're learning how to refuel the plane while we're still in the air. And that's something that I thought of this morning and wanted to share this image again. Sometimes we get to touch down and land and complete. And sometimes our pandemic evolves and we see what's next, what pivot, what change. And it's really important to refuel. And that's what we do in this group, is we learn how to refuel, whether or not we're landing or we're learning how to refuel as we continue to fly and look for that landing strip. So next slide. Thich Nhat Hanh shares, community is the guru of the future. And final slide, Nicole. This is an image that is our provider well-being framework. And if those of you who are listening don't have a copy of this, this is part of the Honor Self Toolkit, which is free on our website at the Providers tab. And this framework really acknowledges that it's emotional health that's very foundational for feeling well as a healthcare provider. And we don't learn this in our training programs necessarily, although I do think nursing has a great advantage over physician training programs. And we are healthcare workers and integrative professionals today. But some of you have as your work teaching and mentoring and inspiring emotional health. And how important emotional health is informed by community, being connected and being able to share and give and receive personal sharing in our stories. And that is essential for feeling emotionally healthy and human. So both emotional health and community, both of these things will inform our mindset, our day-to-day narrative. The mindset is sort of the little slit, the window through which we see the world and through which we receive the world. And our mindset can be quite constricted and contracted. And it can also be quite expansive and trust-based. And of course, we are going in and out of trust and fear all the time in our mindset. And what we do in this group is we seek to create more of a foundation for our own emotional health and supporting each other as a community so that we can maintain that more expansive mindset, so that we can see the solutions and also see that this is a healing journey as a community. This is not just each of us figuring it out. This is an evolution and a journey of creating systems inside us and around us that serve us and that are based in health. So for those of you listening to the recording, I hope you have a wonderful day. Thank you.